Hi, happy whatever day it is. Here are 4 simple tests you can do to not look absolutely silly as a sub-I or intern in emergency medicine. I want you to think finger stick, EKG, pregnancy test, and a bladder scan. So finger stick, if you have a code stroke protocol in your hospital and you're like, oh, their eye is down and out, they're confused, they're diffusely weak, I'm going to call it code stroke. And then you learn later on a serum chemistry that their sugar is 35, silly. Get a finger stick. It's very, very easy to do. Number 2, EKG. Obviously for STEMI things, but also for syncope, and also for your chronically ill renal patients, your cancer patients. If you miss signs of hyperkalemia on an EKG because you waited for a serum, and then it comes back at 7.5, and you did not treat it, silly. Get an EKG. 3, pregnancy test. A lot of hospitals will have a protocol like up to age 50 or 55 or 100 years old, whatever. Anyone with a uterus gets a pregnancy test before they get certain imaging. UPreg is often a stat lab, takes like 0 seconds to do, and it would be really embarrassing if you see a fetus on your CT abdomen pelvis that's looking for appendicitis. Don't be that person. And speaking of CT abdomen pelvis, if you have a 75-year-old guy on Flomax with severe lower abdominal pain, and then you find out that they have urinary retention from the CT abdomen pelvis, silly, waste of time. Patients like that, I tend to go into the room with the ultrasound, and if they're in distress and you see a giant bladder, you're kind of done, at least for the initial period. You can give them a urinal. You don't need to leave the room, find a nurse, find a tech, say, can they have a urinal? Like, know where the urinals are. It takes 10 seconds to find one, hand it to them, and see if they're able to void. If they're not, they might need a Foley and a trial to void or something like that. Do they have a lot of clot burden? Are they on a blood thinner? Do they need CBI or continuous bladder irrigation? You don't need a CT abdomen pelvis for that. You don't even need lab work initially. If they have severe retention, it's going to be useful at some point to see if they have like a post-renal azotemia, right? But you don't need to wait a couple hours to get the blood work, get a chemistry, make sure that they're approved for IV contrast, even though contrast-induced nephropathy isn't a thing. Stop trying to make it a thing. So those are 4 surefire ways to not look silly. If you're on a sub-I right now and they're like, what do you want to do? If you mention any or all 4 of those things, you're at least a B+, even if you got the rest of it wrong. Okay, have a good day.